Hi, in this video I'd like to discuss PCOS and also why we need to take it very seriously. So PCOS stands for polycystic ovarian syndrome, and it is due to the congenital presence of these testicular tissues within the ovaries of these women who have them, secreting excess levels of testosterone, giving them the distinct symptoms of excessive acne and also frequent skipped or missed periods, and also a hairy, predominantly hairy features and other symptoms as well. So even today we cannot say for sure what exactly is the root cause of PCOS as to why these women have this absence of these Leydig cells in their ovaries where they shouldn't be present at all. Here at Antai Hospital, we believe that maybe during the development of the fetus, during pregnancy, there might be some form of infection or interference that has happened that affected these Leydig cells from not being removed, causing them to be left over in these ovaries. We cannot say for sure, but these are all theories at the moment. A lot of research is still underway. And another important thing to keep note is that PCOS needs to be treated when you are diagnosed. Do not hold off your treatment, even though there's not so severe symptoms. You're not really affected. The root cause of PCOS is imbalance in your endocrine hormones. Long periods of imbalance in your hormones has a high risk of causing carcinomas of the reproductive system. For example, cancers of the endometrium or even the uterus. Now, we've recently seen a patient with this case where she had PCOS and she didn't receive treatment, and when she's over 10 to 15 years of this constant imbalance of hormones, she was then diagnosed with a cancer of the endometrium, and she was given the treatment of a hysterectomy, which is the complete surgical removal of the uterus. Now, we want patients to avoid this because surgical removal of the uterus is quite a invasive procedure, and it should be only done if it's cancer or a malignant growth or invasive growth. Otherwise, we do not recommend hysterectomy, and this type of cancer can be avoided if you took the PCOS seriously initially. So here at Antai Hospital, our diagnosis is, of course, we will be checking for a physical examination of your symptoms. We'll also do a blood profiling to figure out what hormones are imbalanced. Most likely is testosterone and other hormones such as luteinizing hormone as well. And treatment is that we will be using 3D laparoscopy to go into the ovaries, pinpoint the location of these Leydig cells, and then surgically remove them. Now, in our history of treating patients with PCOS for over the past 15 years, we've seen significant success in this, and these types of patients recover. They're able to menstruate normally, they're able to get pregnant naturally and have full-term pregnancies with healthy children. So if you'd like to find out more information about PCOS, why we need to take them seriously, what are the treatment options, please visit our website, get in touch with us today. Leave me some comments down below if you have any questions.